Well, welcome everybody. This is Kim Evans, and we are on Inspired Conversations. I am very excited to be able to introduce to you this wonderful new practice here in Lafayette. It's East Bay Health, and I have here as my lovely guests today Naomi Breckon and also Tracy Wu, and they also have two other partners, Maha Hana and Cindy Gershen. Welcome to Inspired Conversations podcast show.
Thank you.
Thank you for having us.
Well, I'm very excited to introduce your practice here that's located in Lafayette, California. And I hear that you're 1 year now. You're getting ready to celebrate your 1 year anniversary.
Yes, and in fact, we're having our celebration on Sunday, November 3rd, between 2 and 4. It's kind of open house style. We'll just have some appetizers. The clinic and the community space will be open for touring, so people can just drop by anytime during those 2 hours.
So before I get into sharing the audience about your practice and what you do, I have to just mention how excited are you two that you have already now about to accomplish 1 year in practice?
We are so excited, and it was definitely a big journey to get here, and we are very proud of ourselves for how far we've come and the impact we've already made in just a year.
Wow, I am so excited. Well, let's get right into it. I'd like to introduce Tracy. May I start with Dr. Tracy, graduated from Williams College with a double major in chemistry and studio art. She then worked for a startup company in Los Angeles while completing training in a variety of bodywork modalities. Afterwards, she went to University of Texas Medical Branch and graduated in 2020. Naomi graduated from UCLA and then managed a surgery center for several years. She was then accepted into the maternal and child health program at the Peace Corps Volunteer in Guatemala. Wow, impressive! For 2 years. Subsequently, she attended Tulane School of Medicine and graduated in 2020. Okay, now I want to know, tell the audience, how did the two of you come together as a doctor team? Share your story. The
So,
short version.
so in the very exciting year of 2020, when everyone I think was a little health focused and concerned globally, we actually both started residency together in John Muir for family medicine residency here in Walnut Creek in Concord. And so we actually were in the same residency class for family medicine. And so we met for our post-medical school training and actually worked together for 3 years.
Mm-hmm. Yep. And the idea for this clinic was kind of the seed for it was planted in our first year. I think it was like 3 or 4 months into training that we decided to start dreaming about this.
That had to take a lot of courage, a lot of boldness. Most doctors, yet it's just something automatic. You want to work for some of the top hospitals, the John Muirs, the Kaisers, and things of that nature. But very rarely in this time are doctors coming out from medical school or from their experience going straight into private practice. Why do you think that is?
So I think looking at it from kind of a bigger perspective, there's a lot of reasons. The first one is the healthcare system in the United States and the way that insurance, especially reimbursed primary care doctors, is very low. And it's actually even hard to get the overhead without seeing 20, 30 patients a day in private practice, not to mention all of the other expenses and complications that go with it. And to be honest, right now for primary care doctors, and that's going to be your internist, your pediatrician, family medicine doctors, all of those, we're not trained in residency how to go into private practice. You're trained to be physicians, to be plugged into big systems like Kaiser, Sutter, John Muir, and to work within those systems. So it takes a lot of extra work outside of the training we're already set up for to do that.
Got it.
And then the reason that we decided to do that, even given the challenges, is I actually had to have two small children, but had two very small children in the beginning of residency in 2020. And I just very quickly knew it wasn't going to bring me the fulfillment and joy in my career long term, seeing 20 to 25 patients a day.
Mm.
And I wanted to be able to feel fulfilled both as a physician and to feel like I was having enough time with my patients.
Yeah, and we both knew, I think even before we met each other, that eventually we wanted to go into private practice and just have control of our own schedules and time. But because of the way we were trained, even starting in medical school, we just had this idea like, oh, we need to work for a big system for a few years, get some resources, pay off some debt, and then start our own thing. But when we met and started on this training journey, we quickly realized that a few years, even just a few years in a big system would probably kill our passion for doctoring. And so at the time, I had known about a practice model called direct primary care.
Mhm.
And Naomi had always wanted to work for an FQHC, or a federally qualified healthcare center, which is usually government funded and serving the underserved in areas throughout the U.S. And so I mentioned this model, the direct primary care model, which we can get into a little later. And then Naomi did a little research and actually found a couple other clinics in the Northern California area that kind of combined kind of the heart of service, giving back to the underserved with this direct primary care model. So that's kind of how we started dreaming. Was we found a couple places, we thought, hey, this might actually work, and then started from there.
I love that. And we could segue into your mission statement, actually changing healthcare with nonprofit direct primary care clinic model, which we'll get into a little bit. Uh, as saying as having longer visits, direct communication with your physician. You are also bringing in culinary medicine, care for the underserved, low income, newborn and breastfeeding support, and after school classes and community education. This is like an all-inclusive. This is just a beautiful, inspired model. Tell us more about that. Tell us more about your practice difference from the Kaiser and the John Muir. What makes your clinic stand out? Share more about that.
Yeah, and I think first for the big systems like Kaiser, Sutter, John Muir, Stanford, UCSF, they're very much needed and important, and they're connected with the hospitals. So if you have to see a cancer doctor or a kidney doctor, it's important to have those systems. So
Yes.
we definitely say, want to make clear that those systems are also important, but the reason that we can do this type of primary care is we are the patient's basically medical home, and so we're managing them as a whole person. So what primary care and managing people in a kind of a holistic way means to us is, first of all, food is medicine as well. And so a lot of people with obesity, diabetes, high cholesterol, we need to also think about what's going into their bodies with food. And so we actually have a chef, Cindy Gershen, that works with them. And also it all starts, that starts very young. So we have actually after school classes and kids come to learn how to do healthy cooking that also tastes good. Then we also know that mental health is very much part of primary care. And so we were able to start our first mental health initiative with this postpartum support group that has an actual licensed therapist and a pediatrician running the group.
Mm.
Yeah. Yeah. And really, the big thing we found missing when we were training was just not having enough time with patients. When we started out, we had about an hour to see our patients, to write notes, to kind of do everything. And we were like, this is great. But within 3 years, we were trained to see actually 12 patients in a half day instead of 3 patients in a half day. And at that point, it's like maybe 5, 10 minutes with the patient. And then, if we wanted to spend the full 15 to 20 minutes, that meant notes, working on notes after all of seeing our patients. And so our model with the direct primary care is that we wanted to have more time with patients. So instead of just 5 to 10 minutes, we actually have 30 to 90-minute appointments with our patients. And they also have direct access to us. They have our cell phone numbers and can text or call anytime. Um, and we don't take insurance because of this increased access and this increased amount of time, just because so much money and time needs to be spent on billing insurance. Oftentimes, a huge chunk of cost for private practices is people, billers,
Mhm.
and needing to negotiate with insurances. And just that whole thing can cut a lot of overhead costs if we just, bypass that. So our system is that patients pay a monthly or yearly membership fee. And then they have access to us, to longer appointments, to same day, next day appointments usually because we have a smaller patient panel. And we also offer some other perks like in-house lab testing. We can check things like electrolytes and cholesterol, blood sugars, COVID tests, flu tests. We do a lot of that in-house for free. We also offer medications, certain medications like antibiotics, some high blood pressure medicines just in-house so the patient, if they're sick, they don't have to take that extra trip to the pharmacy. And so the main thing we're offering with the by bypassing insurance is just more patient care time. And with our nonprofit piece, because we'll have patients paying us and supporting us, and also we can get donations and have fundraisers to support our nonprofit, we can give away up to half of our care for free for underinsured low-income patients.
Now that is excellent. I'm so glad you mentioned that. So how do you tailor your care approach to meet the needs for the underinsured and low income patients?
So we definitely do the same quality of care, whether they are paying patients or if they are the free patients. So they're going to have the same 90-minute first appointment, same access to us. Everything's going to be the same. Really, the only difference is helping them get into Medi-Cal if they are open for that. Sometimes people are not comfortable applying to Medi-Cal for various reasons, but if helping them get to insurance, helping them find the cheaper cash prices, helping them get to community services like Operation Access, which does free operations for the uninsured patients. So the big difference is basically the community resources and support for them. But our care is the same quality and it's really equitable.
Yeah, and also since California expanded the Medicaid program to all of its residents in, I think, January of this year, we're finding that a lot of people, they can apply for Medi-Cal if they wanted, and the wait can be months before they even get approved for that. And also, once they get approved, they need to go in and establish care with a primary care doctor. And usually that wait list, I think right now is 9 to 12 months. So if somebody is running out of medications, they just moved from out of state and doesn't have a job, and they need care. And so we're providing that care so that they could see us for a few months while for medication refills until they can actually get in to see a provider that takes their insurance.
Yeah. So I'd say the big difference is a lot of our free patients eventually get on Medi-Cal. And so we're basically helping fill that space and time when they're uninsured. And then we just support them until they can establish care with insurance. Whereas a lot of our paying patients, it's going to be more of a relationship that's going to be over years.
Wonderful. Wow. This is so enriching. Your hours and days of availability, is it extended because you can visit and see more of your patients, or is it more uniquely designed? Tell us a little bit about your availability that patients can come in to enjoy services with you all.
Yeah, so our office hours right now, just what's listed on our website, just usual business hours, 9 to 6. We wanted to make it a little later since oftentimes people want appointments after work.
Okay.
And then we're, listed as closed on the weekends. But once you become a patient here, you have our direct cell phone numbers that you can text or call, like I said earlier, anytime. Of course, typically when we tell people that, especially our colleagues, they're like, are you sure that's a good idea? Like, aren't you getting woken up every night? But no, actually, we talk to our patients and they understand that unless it's something really urgent, they can wait until the next day. Some patients actually have a hard time like reaching out to us after hours because they're like, I'm not supposed to be bothering you. But really, we are available, especially for emergencies. And if one of us go on vacation, then the other physician is going to cover the patient. So even if myself or Dr. Breckon aren't available for their patients, they'll be able to reach a doctor anytime.
Yeah. And like, for example, a patient of mine on Saturday was having issues and she was vacationing in Tahoe. So I was able to do a Zoom visit with her, resolve it, get the medications to a pharmacy there same day. So we're able to be available when we need to be for our patients.
And I think our patients have one of the biggest feedback and most common feedback is just they're so surprised at how, we answer the phone when they call, and also just how quickly we can see them when they have a concern. It's usually within a day or two that we can either see them in person or at least, same day have a phone conversation about what's going on. It really helps us kind of keep abreast with what's going on. And so that we actually, when they do come in, we don't need to spend a lot of time figuring out what's going on since we've been keeping close tabs on them through texts or phone messages. So yeah, it really, I think, streamlines the care.
Very patient centered. That's amazing. It's excellent. I'm so glad you're bringing that back. In terms of if your patients need surgery or a minor operations, what do you use in terms of access to your local surgery centers? Where would they normally get that done?
So it's less about the center and more about the physician. So since we trained here, we know a lot of the John Muir, Stanford, UCSF physicians. We have a lot of their phone numbers. So for example, this morning I had a patient who had an urgent finding. I needed to call a gynecologist to get her in, and I got a hold of her within an hour, got her urgent imaging same day, and she's going to be seen by the gynecologist this week.
Yeah, and usually when folks need specialty care, their insurance will take care of that. Usually patients with a PPO insurance can go to any specialist, so it's really easy for us to just refer them to who we like, and then they go ahead and get an appointment, and all of their fees associated with that, surgery, procedures with the specialist usually is covered by their insurance. And also labs, imaging, medications are often covered as well. And so it's just the primary care piece, kind of what they're paying for with their annual fee is for access to us and for things just to happen more quickly.
Nice, nice. So let me also ask you about your community education programs and your after school classes and how does that contribute to the mission and bridging healthcare divide? You're also offering after school classes. Share a little bit more about that.
Yeah, so we have right across the street is Lafayette Elementary School. So we have primary age kids that come across the street, and we've had several different iterations of classes over the past year. This fall, we have a healthy cooking class, and then we have a mindfulness class. We had a science class, and we've had different kind of cooking workshops where they can really learn how to cook in a healthy and delicious way.
Mhm.
And then we've also had different classes again for adults, so that way that we can help basically reach our community and, start getting healthy in the kitchen as well.
Excellent. Excellent, excellent. So what advice would you give families practicing self-care during the busy holiday with your team that you have there that you're going to have coming up for the holidays? Share more about that.
Yeah, we get that question a lot, especially around this time of year. And we opened, around October. So we had the first Thanksgiving and Christmas. One of the things I tell my patients, because oftentimes they're telling me, like, oh my gosh, there's so many social events, like all the rich, tasty treats are laid out and I can't resist. And one of the things I often will tell them is just try to eat something, healthy at home so you're not ravenous when you go and to these parties and just have a little taste of a few things. So you're not restricting yourself and you get to enjoy the social part of it, but you're not also just, eating all of your calories out there. So eating something at home and don't go to parties hungry is like my common piece of advice for patients during the holidays.
I love
Yeah. And I think the other thing that's really common now is flu and COVID and RSV very much are going around. And so I'd say that the one benefit of the COVID pandemic is now there's at-home tests for COVID. So I would definitely recommend if you're feeling sick to get tested for flu and COVID just so that you can isolate and not spread it to the family. And then the big piece of advice, especially for new moms, is this a baby under 6 weeks has a fever, that basically is an ER trip no matter what. And a fever is 100.4 degrees Fahrenheit. So I think a lot of times new moms don't necessarily know that, but with the really young babies, that's why it's so, so, so important to have that knowledge and to know kind of how many wet diapers they need to have if they're eating correctly, and then if they get sick, what they need to do and where they need to bring them.
Nice,
Yeah.
nice.
And also, we're starting a new free community class in November.
Mhm.
So I will be teaching kind of a mindfulness movement breathing class once a week. And that'll start sometime in November, in the beginning of November. The information will be on our website. And signups will be on our website. And it's basically an hour of coming together and doing some mindfulness practices
Mhm.
and drop-ins. You don't have to come to every class, but just come on when you have time. And hopefully it'll help with de-stressing over the holidays. I know it can be crazy trying to keep up with family and presents and meal cookings and all sorts of things. So yeah, we'll have that available free to the community. A donation is always appreciated since we're a nonprofit, but that will be available to anybody who wants to drop by.
Is there any other classes that you have coming up in terms of for your self-care for the holidays that you would like to share with the audience?
Well, our postpartum support group cohort is currently going and is going to start again in the beginning of January. So that's going to be for moms with babies 0 to 6 months, and so you'll be able to sign up for that on our website. And again, that is going to run for about a month. It's once a week, and there's a pediatrician and a therapist there to offer both postpartum mental health support and lactation support.
So how can new mothers benefit from joining your free postpartum group? What can they expect when they attend it? Share a little bit more about that.
Yeah, so it's set up like a group therapy class, which means that there's no more than 5 moms with their babies in the class.
Okay.
And the therapist and the pediatrician lead the group together. And up to 25% of moms experience postpartum depression or baby blues. And oftentimes it goes undiagnosed and ignored, and it can cause a lot of extra stress, especially for new moms.
Mm.
And so this is a way to actually start to support the mental health during this really critical period. And then the pediatrician, Dr. Hannah, actually is one of the leading experts on breastfeeding in the area and trains all of the lactation consultants at the John Muir Walnut Creek Sanford location. And she is there to offer breastfeeding support as well during these classes.
Yeah, so the group really helps moms just realize that they're not alone in their journey because oftentimes moms will say like, "Oh my gosh, like everybody seems to be doing fine and I'm the only one struggling." And when they come into this group setting where they can really share their experiences, and oftentimes there's moms in kind of different stages of their baby's development. One who might have a 6 months old can give a little comfort to the one who has a newborn about like the sleep will get better. You will start to get sleep. It's just making it through. And so I think we find that that group camaraderie really helps people feel supported during this challenging time.
Especially during the holidays, it can be very
Mhm.
difficult and daunting for a lot of new mothers. So this is great that you're offering it, especially at this time.
And then also with the holiday season too, the one other thing we did last year that was really successful was we offered private cooking classes slash parties for folks who wanted to bring their family and friends for kind of a celebration, but also learn about
I'm
culinary
ready to
medicine.
segue into Cindy Gershom. Yes, so
Yes.
speak more about that. Yes, getting to the nutrition piece of it. Yes.
Yeah. Yeah, and so folks can reach out to us and book like a private dinner. So you'll have Cindy Gershen leading the cooking, and one of us will be there as well because we do give a little presentation about healthy food and just general guidelines to eat by. She comes up with a beautiful menu, and it can be tailored to the guest's needs. So vegan, vegetarian, omnivore, whatever, just let us know ahead of time. And then she'll actually create recipes and um, put the guests and your family to work to cook these recipes. So you actually get some, knife skills and cooking skills while you're at this party. And so everybody cooks together and then share a meal together. And we hosted a couple of these last year, and people were really, really happy with the results. So that is something that's not listed on our website. So you will have to contact us if you wanted to book a private party. Usually we do 10 or more folks, and we can host up to 20 people in our space.
What an amazing team of doctors and professionals that you have. Cindy Gershen, how did you get Cindy Gershen on staff here with you all? Amazing. What
Yeah, so
makes
I
it important?
actually met her in 2021 through a mutual friend, and we had coffee, and I told her about what we were doing, and she basically said, I love it if you can find a space for me. And so in 2022, 2023, when we were looking at physical spaces, she would come with me into each location and try to figure out where she could find a space. And she was being very creative. There was like exam room. She's like, I can work here. I'm like, no. And so that's why we were so thrilled when we found this space that had, and I invite everyone to go to our website, eastbayhealthcare.org, with a video where you can kind of see what our space is. But one side is a pretty traditional primary care clinic. We have a couple exam rooms. We have private offices that we're sitting in right now. To have one-on-one conversations with our patients. Dr. Who also has a body work room because she does massage. And on the other side is where we have more of a community center where we do the different group classes, where we have the postpartum support group where the kids go, and it feels much more like a really homey community space.
Yeah, and I think when Cindy first connected with us, she was super excited about our vision, but a little skeptical. We had big dreams, but as we continued to move forward with, finding a space and having a fundraiser, we had a fundraiser that was attended by about 200 members of the community when we were still in residency, and we invited her to that, and she saw, the community support we were getting, and so step by step, she was like, "Wow, they're serious about it." And so by the time we found the space and was renovating it, she was like, count me in. And so we're so fortunate to have her. And also Dr. Maha Hana, she was kind of the same. We met her during residency and told her about our plans. And she's just been following us along and then was like, when you're ready, I'm ready to help. So we're really fortunate to have these folks on board.
And
And
let me also add, they're all powerful women. It's
yeah,
a powerful
oh,
ran by women. We
yeah,
just didn't say
and
that.
yeah, I know. And that has just been what we have found is we've just had these wonderful, powerful women that have been coming together. And I will say, because in the beginning you were mentioning all the different facets of East Bay Health, and I will say that it's very much evolved over time.
Mhm.
And it's just us saying yes to what the community needs are. And when people step forward and say we want to help, we say yes. And so we just have very much been stepping through the open doors and listening to the community. And we've had just such wonderful, wonderful support of all, especially a lot of women in our community that have come forward and say, I want to join and be part of this. And that's really how it has evolved into what it is today. And I'm going to say that next year, I think you're going to have even more things to mention to the list because it continues to evolve.
I love it. Food is thy medicine, and medicine is thy food. And
Mhm,
when a patient comes to your practice, they are getting a holistic approach to healing and wellness. And
mhm,
you all are living that. You're
mhm.
exemplifying that in the community. That is just so totally awesome. What do we have to look forward to for 2025 in terms of in January? What are some of your classes that you have coming up, or are they on calendar yet for January? I'm
So
I'm already speaking January for you. I'm already speaking into existence. What do you have coming up?
yes, so we definitely still have to update our website with these offerings, but we will continue to offer the after school classes. That has been a huge hit since we, started them a year ago. And so they are open to kids from elementary school and even through middle school. Depending on the level of interest, we can also take high schoolers as well. But that will be on our website soon, since we
Mhm.
know the moms love to sign up for things ahead of time.
Exactly.
This one included.
I'm speaking it forward. Great.
Yeah.
Yeah.
And then, yeah, Doctor Who's mindfulness class will be going, the postpartum support group. And a big goal we have for 2025 that you mentioned it is we really want to expand our mental health services and have other support groups for more the broader community. And so a big goal we have is to get enough donations this year so that we can start offering more support groups. So I invite anyone who wants to support our cause. We have a donation page on our website, and then you can help support that goal of really having more accessible and equitable mental health care services in our community.
Excellent.
And to add on to that, next year, I think at some point I will be offering another class more focused on the elderly or even just middle-aged folks who want to learn about fall prevention and healthy movement for, their joints. Because oftentimes the wear and tear of the joints of, the body can use some help with that. And I've been taking classes in terms of healthy alignment for joints and just balance and fall prevention. So I'm hoping that 2025 will be when I can start offering some of these as well.
I could just imagine what 2025 is going to be because you are already to a great start as you're getting ready to celebrate again. Congratulations, your party that's coming up, your anniversary on November the 3rd. All is welcome, I'm assuming, in the city of
Mhm.
Lafayette. That
Absolutely.
time will be between 1 and 3. I'd like
Two,
to also
two
one
and four,
two
two
and
and four.
Okay, 2 and 4. I'd like to also just one last thing. How can people give to you if they want to give to you private donations? Should they go to your website? So how can people give to your practice?
Yeah, so our website is eastbayhealthcare.org, and we actually have a donation page. So on the top it just says donate, and you can donate recurring or one amount. You can do ACH or credit card. If you want to have a check, come and visit us, and we are happy to give you some healthy muffins. And what I will say is we're a nonprofit, so that means that this is a tax write-off tax deduction for that season coming up, and we can give you that letter for the IRS as well. And then you'll be helping support the community. And like I said, the goal for the donations this year is I hope that when we're on your podcast next year, we'll be able to talk about the additional services that we have at that time.
I love it. Doctors Naomi Breckon and Tracy Wu, Dr. Maha Hana and Cindy Gershen. What an awesome team. Is there anything you would like to lastly to mention and share with the podcast audience before we close the show?
I guess it's, just to the general community, if there's any people who are studying to become physicians, if you're pre-med, if you're in medical school and feeling a little burnt out or uninspired, please feel free to reach out to us. We have many pre-med students, medical students, and residents that have worked with us because sometimes the system can be really overwhelming. So we definitely want to offer our support to them. And then for any patients, again, reach out to us on our website, give us a call, and we're here for you.
Okay.
Yeah, and then our email is info at eastbayhealthcare.org. So folks who want to drop us a line, that's also all listed on our website. We would love to hear from you all.
Well, thank you. It has been a pleasure wishing you the best of success and also in 2025. And everyone, thank you very much for listening. I am Kim Evans. I am your host to Inspired Conversations. Thank you very much and have
Thank
a very
you.
good day.